It offers a variety of visit options that can range from on-demand video chats to e-visit telemedicine that allows you to message directly with a provider. I want to emphasize that this is not a lower level of care, and this is care that can make available to you appointment scheduling, referrals to specialists, and prescriptions if necessary. These visits range anywhere from $29 to $49 and allow you to communicate within minutes with a physician or clinician for many of the same ailments that you would utilize a walk-in clinic or sometimes the emergency department for. As mentioned, if needed, the clinicians who are available to you can make referrals, they can write prescriptions, they can get you the care that you need as immediately as possible and at a low cost. You can visit leehealth.org, as mentioned, to utilize these service options, and a link for Get Care is available on that homepage. We also offer a variety of mobile healthcare services in the community that many community members may not be aware of. Here in Lee County, we utilize a service called Dispatch Health, which is a national provider of in-home medical care. Through this service, patients can be treated by clinical care teams from the comfort of your own home for many of the conditions that are, again, currently treated in urgent and emergent settings. Lee Convenient Care Clinics are available in a number of different locations across our region, and that is a walk-in clinic option that can provide many of the services that most of our patients need when they need them. Lee Convenient Care operates in 4 locations throughout the county. It's open 7 days a week, requires no appointment, and offers extended hours. There's also the Lee Health Kids Urgent Care at the Golisano Children's Health Center in Naples. If you're in South Lee or the Naples area, that's an option for immediate care with current wait times and that can be identified online. So both the Lee Health Urgent Care Clinic as well as the Lee Convenient Care Clinic, you can find wait times for those clinics posted also on our website. I'd also encourage our patients who are on MyChart to use their MyChart app to check into those clinic appointment visits when you're on the way, or to check into those urgent care, non-scheduled visits on the way as well. In addition, reaching out to your primary care clinician's office to make an appointment or discuss your symptoms is always an option that is available to you as well. If you're not experiencing an emergency, oftentimes the physician who knows you best is a great option to discuss symptoms and determine what environment is right for you. We're asking anybody who has minor COVID-19 or flu-like symptoms or anybody who wants to be tested for COVID-19 or either not to come to the emergency department, but rather to utilize the other alternative environments that have just been mentioned. If you're experiencing severe symptoms of COVID-19 or the flu, RSV, or any life-threatening illness or injury, that includes difficulty breathing, chest pain, stroke symptoms, persistent vomiting or abdominal pain, we encourage you to continue to use 911 or seek immediate medical attention at an emergency department. As we see illnesses circulating in our community, we want to encourage everybody to take necessary precautions to try and limit the risk to yourself and your loved ones or those around you in the community. Remember things like hand washing that can go a long way to prevent transmission of disease or viruses. Use hand sanitizer if soap and water aren't readily available. Talk to your healthcare provider about the right vaccines for you, given your indications, your risks, and your exposures. If you are at risk or not feeling well, we encourage you to wear a mask or to stay in and limit necessary traveling or movement outside of the home. If you're experiencing mild symptoms of viral illness, again, stay home, recover, get well. That's the best place for you to regain your health. Again, we want to thank you for being here today. Hopefully it was helpful to hear about some of the alternative sites of care that we offer, some of the alternatives to seeking care in the emergency department. Again, for your non-emergent needs, we are here for you in a variety of different locations, and we encourage you to take advantage of them. Thank you again. Happy to take any questions as you may have them.
Can you tell us how many beds you have right now and how many people on staff?
Yeah, so our beds are fluctuant on a nearly daily basis. We do everything we can to expedite care and get patients in and out of the hospital with the treatment that they need in the shortest period of time possible. It's not unusual for us to operate anywhere between 90 to 100% capacity and even create additional capacity when necessary throughout the full site. We're a licensed approximately 1,650 bed system as total, but again, that number fluctuates on a nearly daily basis as far as what's available. I wouldn't say that we're necessarily seeing record numbers. We're sort of, again, always operating close to the limits of our capacity in trying to find as much available capacity that we can for the community. What I can say is that in partnership with many of our partners in the community, EMS in particular, we have heard that they're seeing record numbers of calls through the EMS system. So we're definitely seeing the impact of population growth as well as availability of high quality medical care to the community.
So you brought up a lot of the like the urgent care, virtual care. Let's say we've got a viewer at home and they don't really know much about virtual world. Do you know how many options you have in terms of urgent care facilities? If I'm sick and I live in Lehigh or Cape Coral or Fort Myers and I want to know exactly how many urgent care options Lee Health has opposed to going to the actual ER room or the hospital?
Yeah, so we have our 4 Lee Convenient Care locations as well as the pediatric urgent care in Collier County. So those are the most readily available on-site urgent care locations. Those are all posted on the website as well as the wait times for those locations.
Anything different from this year compared to last year at the same time in season?
I wouldn't see we're seeing anything particularly different last year to this year. We're seeing similar constellation of symptoms and seasonal illness. I think one of the things that we're seeing a little bit differently this year versus last year, we're not seeing as many post-hurricane readmission type situations. I think many people have found that their home environment and home circumstances have recovered from the storm. So some of the things that we've seen that were associated with mold and allergic reaction and things of that nature, I don't think we're seeing it quite the same level, but by and large, we're seeing the same seasonal change that we typically see at this time of year.
So no problem with staffing right now at all? Kind of just a preventative measure.
Yeah, this is really just a preventative. It's an opportunity for people to understand what opportunities are out there for them, really to save them time and save some of the impact on the pocket as well. For many of you viewers who have commercial or government insurance, it's a different cost for you out of pocket when you come to an emergency room location versus a non-emergent location. So we want to make sure that we're giving people opportunities, again, to save time, to save the hit to their pocket, et cetera. As far as staffing for us, we're very fortunate. We have exceptional workforce here as part of the Lee Health system, very committed workforce that want to show up and take care of patients every day. So we're in a good situation when it comes to staffing.
Doctor, I asked this question. I don't know if I just need the soundbite, basically. Cape Coral, we had a bunch of flooding, and there was some word from some people that that hospital took on flooding there in Cape Coral. Did that hospital take on any damage? Was there any issues? And can you talk on what, I know you had to kind of move doors that night. Can you talk on any of that? Is that something that you can at least share with us?
Yeah, I'll just say briefly, you know, what an unseasonably rainy and cloudy season we've had. Coming from the Midwest, I was reminded of what this time of year is like back there. As far as the rain, you know, we did see some very minor water penetration, but nothing of any substantive damage, nothing that caused us to change our operations in any way. Obviously, when you live and operate in this part of the country, you're constantly prepared for the effects that water can potentially have on your operations. So we've got a lot of emergency plans in place should we have to activate as a result of water damage. But in terms of the rain that we've seen recently, no, we didn't have anything substantial that caused us to change operations in any way. Yeah, absolutely. My name is Ian Gonsenhauser, IAHNGONSENHAUSER. I'm the Chief Medical Officer for the Lee Health System. Again, thank you all so much for being here today. Really appreciate your time and getting the message out to our community.
Thanks, Dr. Garland. He goes first.